It's time for Dr. K, Dr. Kevin Kavanagh, retired physician from Somerset, Kentucky. Also the president founder of a national organization called Health Watch USA. Dr. Kevin Kavanagh, can't tell you how much we appreciate you, sir. Thanks for being with us again.
Oh, thank you, Jack. I appreciate it.
We got to have some drama, and there's not a lot of drama involved with the coronavirus. It's just all kind of cut and dry, and you either are on one side or the other. But we had a little drama this week, and I want to start with that, and that the little dust-up that occurred between Dr. Fauci and U.S. Senator Rand Paul. Did you see that?
Yes, I did.
And what was your reaction?
Well, I agreed with Dr. Paul as far as the statement that we are doing about the worst as anybody else in the world, including third world nations. And so I really think we need to look at what we're doing, try better messaging, and let's get back on track and get this virus under control. We're entering a very dangerous time. Look, Jack, I'm not going to predict what the virus is going to do in the future. It's kind of like predicting the stock market. Yep. But even if we perform as poorly as New York State did in the initial beginnings of this virus, we will have 600,000 deaths nationwide if you adjust things by population. And that's not good. And that's if you think this infection is going to burn itself out after it reaches a certain level. And we just don't have evidence to be sure of that. In fact, most of the evidence is pointing the other direction. Might it do that? It's possible. Believe me, pray for memory B cells. Those are the cells that can crank out antibodies very fast if your antibodies drop and go to close to zero. And of course, we've had study after study after study showing that in about half the people at 2 months, that's what happens, especially those that are asymptomatic. So let's pray for memory B cells. Let's put on masks. Let's socially distance. And let's try to blunt any sort of a rise or second wave, which may be coming in the winter.
How did you feel about the comments of Senator Paul regarding the, so-called herd immunity in New York and the comeback that Dr. Fauci had?
Well, I agree with Dr. Fauci. These are two different viruses. When you look at the coronavirus for the cold versus you look at the virus of MERS, SARS, and what we're dealing with today, the spike proteins are different. The cold, as you know, affects the nose. This virus affects every organ of the body. So the attachment protein is completely different. That's the protein your antibodies need to attack in order to deactivate it. They're two different animals. So I don't think that's correct. But there is very slim hope, and this is what I'm hoping for, is that we may have had the virus spread further through the population than what was thought. Because if you don't have antibodies that last long, that means you could be infected in March. Test would be negative. And of course, as we both know, Jack, how good those antibody tests are. So it's really hard to monitor for community spread. And if you have a lot of memory B cells, believe me, this is a lot of ifs, then there may be a modicum of protection and maybe that curve will blunt. But we need to keep in mind, even with all those ifs, if we do like New Jersey or New York has done, we're still looking at about 200,000 or more deaths total in the nation. And that's unacceptably high.
Okay, we'll leave Dr. Fauci and Dr. Paul and go to face masks. You say could be giving people COVID-19 immunity according to researchers. What is this about?
Well, this is a commentary that was in the New England Journal of Medicine. And this is hopeful. And what this is stating is the face mask may not prevent you from getting the infection. It can probably sometimes. But if it does lower the viral load that you're exposed to, then you may well have a less severe disease or maybe even an asymptomatic disease. And the reason for that is it's kind of a race between the viral forces and your forces of who's going to win. And the less people that land on that beachhead with that virus, the more likely it is for you to win. And this makes sense, and it's another sign of hope. And believe me, it's another reason to wear a mask.
Now you say vaccines are problematic. What do you mean?
Yeah, this is problematic on these initial vaccines. And I think we really need to quit magical thinking. We need to back away from the politics, pay attention to the science. The vaccines, which are first coming out, and this is especially true with the Pfizer-BioNTech vaccine, which is the hybrid vaccine between the United States and Germany. This is brand new technology. It has never had an approval by the FDA for any other product using this technology. It's not because it's been bad, it's just because it's never been done before. And one of the big problems with this vaccine, which to me is mind-boggling, is that it came out that it requires storage on dry ice from the time it's manufactured to the time it's put in the patient. So that's minus 100 degrees Fahrenheit. And no one that I know of in primary care is set up to store vaccines that have to be stored in dry ice or that cold. And that is really problematic. Even having enough glass vials that won't fracture at that temperature is again problematic. And if you talk about disparities in healthcare and problems of access of the poor and the people who are working on the front lines, and when I say front lines, I mean teachers and grocery workers, etc., they may not have access to the healthcare facilities that are able to even handle this type of vaccine. So it's going to take quite a while to gear up for this vaccine if it is found to be effective. And people have to remember, when you're dealing with vaccines with this virus, it's not whether or not you're immune versus not immune. There's a third category researchers worry about, and that's hyperimmune. That's having a response that is too large. And that's what we see in the elderly. When they have this high fatality rate to the virus, it's a hyperimmune response. It's why steroids make it better and increase survival. Is that likely to happen? No, but it could. And they do know how to test for it and to make a vaccine safe. They've done it before, but it requires some time to make sure that safety testing can be done adequately and that enough time has passed that you can observe for complications.
Okay, this is from our Auto Tech Service text line. It says, I'm 70 years old, haven't had my hair cut since late February. I'm starting to get my 60s look, minus some hair on top. How safe is it to go to the barber shop, especially at my age?
Well, to be honest with you, I'm kind of in that same situation, and I've chose to stay at home. Again, we're talking about very high-risk people, but I do think you need to call up your barber if you absolutely want to go and make sure that they have good ventilation, they're socially distancing, they're wearing masks. And by good ventilation, it could just mean having a chair next to a window and getting your hair cut during a breeze. I mean, you need to really take some proactive steps. And remember, and this is the one big thing for wearing masks, is that we had an episode of two hairstylists, I believe it was in Arkansas, that exposed 140 clients, another 200 to 300 people in their shop because they were carriers, but everyone was wearing masks. They weren't able to document any transmission. So it can be done safely.
And we have this text. This is from Lou. Lou makes a good point here, Doctor. He says, wouldn't it be possible that the flu season won't be as bad since we're all wearing masks?
Definitely. That has been said recently by the CDC, and we even wrote about that in Infection Control Today back, I think it was August 18th. And because the flu season is dependent upon a virus which spreads through the air, and it doesn't spread as easily as COVID-19. It has an R0, or the infectivity of the virus is 1.3 compared to 5.7. That masks and social distancing should just annihilate it. And this is kind of what happened in the Southern Hemisphere. Many countries didn't experience much of a flu epidemic at all. But it's a big if in the United States because it requires wearing masks and it requires social distancing. And as you know, a large segment of our population is not doing that. So best advice is, let's get the vaccine.
All right, here's another thing I want to bring up. People in England are getting fined for not going along, right?
Definitely. England has done probably the worst in the European Union. And I can tell you that their country and government is starting to take this seriously. The fines are up to £10,000, which is about $13,000 for repeat offenders, or for example, for a business that tends to fire someone or lay them off after they go into quarantine. So they are really taking this seriously. They've also had programs such as getting antibody tests or COVID-19 tests to the public in their homes where they could test themselves and send them back in. And so they're becoming very proactive and they're taking this seriously. They've, of course, have been faced with quite a huge surge in cases and deaths. And their prime minister, of course, was severely affected by the virus.
All right, let's go back to the calls. This is Laura. Good morning, Laura. You're on with Dr. K.
Good morning, Jack. Good morning, Doctor. Listen, that vaccine that has to be kept at 100 below, could that be given at a mass inoculation event like we had for polio when we were kids? They had some kind of an air gun. Do they still use that just blows it into people? I know it really gives you a bruise, but it gets the job done. If they could just have a crowd staged and just walk down hitting arms every 12 feet apart or something, how long have they got before it heats up? I mean, is that possible?
Well, I don't know if it's possible, but certainly strategies such as that of pre-organizing events or scheduling people to come in to get the vaccine, they're going to have to do, because the shelf life of that vaccine, once it hits the doctor's office, may only be about 1 or 2 days. It's whenever that dry ice evaporates.
Yeah, and you know, they might come up with something, but it also has to be practical. I mean, it seems a little impractical to me.
Yes, and I'm kind of concerned on why that was picked as one of the front runners when you had all these problems on the front end. I would have gone more with the Johnson & Johnson vaccine, which just entered phase 3 trials. It requires just a single dose, not 2 doses. That's the other problem with the Pfizer vaccine. You have to do it twice. So the Johnson & Johnson vaccine, I think, is much better. It's more of standard technology. They're the company which made the Ebola vaccine. So let's put our hopes in that bucket. They may be later coming on, but I think as far as getting it out to the population in mass, they are ahead of the game.
How many years have we, before COVID, have we been talking about diseases transmitted through medical facilities? Years, right?
Absolutely years, yes.
And there are several, and I don't think I've heard about anything about any of them since COVID-19. Are they still around?
Well, they're still around. I went to a conference, the Presidential Advisory Council on Combating Antibiotic Resistance. When I said I went to it, it's an online webinar. But they looked at antibiotic resistance, and there are a number of COVID-19 patients that have evidence of bacterial co-infections. MRSA is the most common. And that's something that we've been pounding on, that this needs to be reported. We feel that all of these dangerous organisms need to be reported by all healthcare facilities. It needs to be online. It needs to be real time. I mean, you can find out about lice in your school, a lice outbreak, but you can't find out about an MRSA outbreak at hospitals. And I think this has led up to us not being able to detect COVID-19 spread as quickly because we weren't set up for this reporting.
I agree with you. Have a great weekend. Thank you.
Thank you, Jack.
Dr. Kevin Kavanagh.